In today's video, we are going to be discussing about drug-induced skin diseases. So these can be of three types: minor skin diseases, moderate type, and then severe type. So in this video, we are going to be discussing about minor skin changes. So first of all, abnormal photosensitivity reactions is one of the minor skin changes which are being caused because of some drug therapy. So on the basis of toxicity, these can be of two types: phototoxic or photoallergic. In phototoxic type of abnormal photosensitivity reactions, severity is much more. There can be blister formation, eruptions, and this is actually dose dependent and time dependent. So within 5 to 15 hours of drug therapy, these effects can be shown on the skin. And the other type, that is photoallergic type of abnormal photosensitivity reactions, these are actually not dose dependent and they can happen at any stage or any time of the drug therapy. They can happen even at the subtherapeutic level, and these are actually time independent, so they can happen even in delayed response or even at the time of administration of the drug. So it includes some kind of rashes on the skin and some common allergic response. So we can say that photoallergic reactions are actually less severe than that of phototoxic changes. So photoallergic are time independent, dose independent, whereas phototoxics are dose dependent and time dependent reactions. So one question that could have come to your mind, that why these reactions are being caused when you are taking a medicine but not when you are not taking it. And this is because these agents are actually, or their metabolites are actually present in skin, under the skin. So what happens when you are exposed to UV rays or sunlight? What happens that these undergo some changes or some photosensitivity reactions. So these are actually abnormal photosensitivity reactions because they are not usually occurring at the normal time or at normal physiological condition. So but when you are having that agent in your skin, what happens? The reactions are being proceeded, and in response to those reactions, these changes are being occurred or appeared to your skin. So now these abnormal photosensitivity reactions can be of two types. They can either be localized or systemic. In localized, what happens that if you have applied a certain agent which have the ability to cause these reactions, so if you have applied that agent on your skin, that area of your skin will be affected, but any other exposed area will not be affected because you haven't applied any of that agent to that area. So example of agent which have the ability to cause localized abnormal photosensitivity reactions include sunscreens having PABA, that is para-aminobenzoic acid, or benzophenone. So moving towards systemic type of abnormal photosensitivity reactions. In these type of reaction, what happens that when you take a medicine having this ability, what it will do is that it will spread in all of your skin, and when UV rays come in contact with that metabolite or that drug present in your skin, it will cause these reactions. And as it is present in all of your skin, so all of your exposed areas of skin will have these kind of reactions. So example of agent that can cause these kind of changes is benzoflumethiazine. So now moving towards the preventive measures which you can take to avoid these kind of changes. First of all, avoid sun. Second is use some kind of shades or sunglasses, and number third is use of sunscreen. So you need to take that kind of sunscreen which does not have PABA or benzophenone, because they themselves are actually agents which can cause localized abnormal photosensitivity reactions. So you do not want that. So to avoid this, you need to check that your sunscreen does not have this to cause any kind of localized photosensitivity reactions. Okay, so if you have ever observed, the sunscreen have two things, that it provides you protection against UVA and UVB radiations, and it also have SPF. So SPF is mentioned with numbers like 20, 40 or 50, and protection against UVA and UVB radiations are made with stars, like out of 5 star, if your sunscreen has 2 star, it means it provides this much protection against UVA and UVB radiation. If it has 3, and so on. So this is how you can check how much protection your sunscreen is providing you against sun. Now, the agents which are involved in causing such kind of changes. So first of all, localized eruption causing agents include topical NSAIDs and PABA or benzophenone that we have discussed previously in sunscreen. So systemic eruption is further divided into two types, that is phototoxic and photoallergic. So agents which can cause phototoxic effects or phototoxic eruptions include amiodarone, that is actually antiarrhythmic drug, and nalidixic acid, which is frequently used in UTIs and itself is quinolone, and tetracycline, which is well known antibiotic and NSAID, and clopramazine, which is antipsychotic drug. So these agents can cause systemic eruptions of phototoxic type. So now moving towards photoallergic type of systemic eruption, it includes NSAID, which is also present in localized eruption causing agents, and number 2 is griseofulvin, which is actually antifungal agent, and number 3 is sulfonamides, which is antibiotic, and number 4 is thiazide diuretics, and number 5 is sulfonyl ureas, and sulfonyl ureas are used for diabetes mellitus. So pigmentary changes is one of the minor changes next to abnormal photosensitivity reactions that we are going to discuss over here. So hyperpigmentation, hypopigmentation and skin discoloration can happen in these kind of pigmentary changes. So why actually these kind of changes occur? Because when you are taking a drug, it can either increase or decrease the melanin production, which is skin pigment which give color to the skin. So if that pigment is being decreased or increased, so you can have hyperpigmentation or hypopigmentation. So or you can have some kind of skin discoloration because of some metabolites which is causing skin color to change. So there can be two conditions: either a drug is causing the increase or decrease in the production of the melanin, or the metabolite itself is causing the skin color to change. Nose and cheeks are more susceptible to these pigmentary changes. If we talk about some of the examples of agents which have the ability to cause these kind of changes, it includes bleomycin, which is chemotherapeutic agent, and it causes blue patches on the skin. Other than that, amiodarone, which is antiarrhythmic drug, it can cause skin to have blue to gray pigmentation. And next, tetracycline, which is antibiotic, it can cause blue to black pigmentation on the skin. Anticonvulsant drugs can cause skin to have brown color pigmentation. And mepacarine, which is actually anti-malarial drug, it can cause skin to have blue to black pigmentation. And methyl dopa can cause skin to have brown color pigmentation, and methyl dopa is used for hypertension. Oral contraceptives can also cause skin to have brown spots or brown patches, which can be characterized as facial melasma. So these are some examples of agents which have the ability to cause pigmentary changes. So nail changes are also included in minor changes which are being caused by drugs. So some of the important terms include leukonychia, that is whitening of the nail or a part of nail. So these kind of changes actually can happen because of some chemotherapeutic agents such as vinblastine and vincristine, cyclophosphamide and doxorubicin. All of these are chemotherapeutic agents which can lead to this condition. So next term in these nail changes is Bewes line. These are actually transferred depressions on the nail plate. So if we draw the structure of nail, and this is actually having a transverse depression on your nail plate, like this nail is actually nail called as nail plate, and the skin below this is called as nail bed. So nail plate is actually being attached to this nail bed, that's why it looks like pink or pale in some people. So and when it go, it looks white because it is no longer being attached to the skin. So now moving towards our third term, that is onycholysis. It is actually separation of nail plate from the nail bed. As we have discussed previously, that nail plate is the actual nail, and below it there is skin with which it is being attached, which is called as nail bed. But when these two are being separated, this is called as onycholysis. And this is why you can even touch this nail that far, but not when it is being attached. So onycholysis can happen because of some drug, but it can also happen because of some light reactions. So when it happens because of some light reaction, it is also called as photoonycholysis. It is because of photoreactions. Otherwise, it is simply caused as onycholysis, which is because of some certain drug. So nail changes include both color and texture changes of the nail. So now we talk about the hair changes. Hair changes can be of two types. There can be loss of hair or excessive hair. So first of all, to understand this, we need to understand phases of the hair growth. So there are actually three phases, which are anagen, that is the growing phase, hair follicle growing phase actually, and number second is catagen, that is resting phase, and after that telogen phase, which is actually shedding. And in this phase the hair fall happen. It can be sudden or it can be time taking. So, if we talk about hair loss, alopecia can be caused by various therapeutic agents, but it can be either partial or complete. But one thing to be remembered that it is reversible in case of chemotherapeutic agents. And this could be partial or complete. And how these therapeutic agents actually cause this alopecia? Because these therapeutic agents actually have negative effect on this phase, that is growing phase, anagen phase of the hair follicles. So when this happens, there is actually shrinkage of follicles, and when there is shrinkage, there is ultimately loss of hair. Now another example is of androgen. These also suppress this growing phase, that is anagen phase. And in this way, what happens that there is again shrinkage of follicles and cause of the hair fall. This was our first example, this was our second, and the third example is of estrogen. Estrogens actually upregulate this phase. So in this way, there will be more of the growth of these follicles. So these upregulate anagen phase. Okay. Retinoid therapy, that is used for acne. So in these conditions, there is again increase in this telogen phase. So what will happen? The hair fall will be more rapid. So there will be more hair fall. Promote telogen phase. Okay. So number 5th example is tamoxifen, which is actually anti-cancer drug. It is used for breast cancer treatment, and it is antagonist of estrogen receptor and cause baldness, because as we know, estrogen is actually upregulating, but when we are giving antagonist of this estrogen, what will happen? Ultimately there will be no upregulation, which means there will be downregulation and there will be inhibition of anagen phase. Excessive hair can be of two types, that is hirsutism and hypertrichosis. In hirsutism, what actually happens that there is excessive growth of hair on those part of body where already hair follicles are present, or where there is presence of hair in normal condition too, but their growth is being enhanced in this condition. But hypertrichosis is actually growth of excessive hair on those part of body where normally no hair follicles or no hair growth occurs. So this is hypertrichosis. Like if you are having excessive growth on your head because of some drug, it is hirsutism. But if it is some other part like palm of your hand, so in that part there is no presence of hair, so that is called as hypertrichosis. Now let's talk about the drugs which are involved in baldness. So some of the examples include interferons, which is antiviral drug, and isotretinoin, which is anti-acne drug, and sodium valproate, which is anti-epilepsy drug, and tacrolimus, which is actually immunosuppressant and usually given after surgery. So next is drugs which are involved in hirsutism. Acetazolamide, which is used for the treatment of glaucoma and also used for the treatment of epilepsy. Other than that, phenytoin is also included in this category. Phenytoin is actually anti-epileptic drug, and corticosteroid is also included in this category, and they have multiple functions. So this was all about the minor changes, minor skin diseases actually, which are being caused by some drugs, which are drug induced. So in next video we are going to be discussing about moderate skin diseases, mild to moderate, and after that we will discuss about severe skin diseases related to drugs. So thank you for watching my videos.